At the height of the COVID pandemic from March to May, there was no requirement to wear masks except in the usual hospital settings. The previous evidence available to World Health Organization and others was that masks were of little benefit at protecting you from becoming infected with respiratory viruses. See the report linked in the notes. A possible benefit was if you had the disease, you would not spread it as easily wearing a mask. But if you have COVID, you should isolate. And people who are not symptomatic are not spreaders. Despite numerous studies that have shown no or minimal benefit, our government and others have required us to wear face coverings in many indoor settings, and some even require mask wearing outdoors. The largest study carried out in Denmark by Bundgaard and others found no statistical benefit to mask wearing at preventing healthy people catching the disease. Some less scientific studies promoted in the media show some minimal benefit, but is it enough to make a significant difference? Despite the minimal benefit, our government enacted a mask law in July along with other restrictions. During the summer, if the real objective had been how best to manage coronavirus, they should have been encouraging spread of the virus through the healthy population to get us closer to herd immunity, when warm temperatures and sunlight give most people more natural immunity. But there does seem to be another objective to the requirement for face coverings, and it is very clever and subtle. Psychologists know that the majority of people like to be consistent. If you can get them to agree to do a small thing to help prevent the spread of coronavirus, such as wearing masks, it makes it much easier to gain their compliance when you enact more swingeing laws such as lockdowns and travel bans, and coming soon, enforced vaccination with relatively untested vaccines. And all this to prevent a disease that is less fatal than flu for people under 70 at 0.05%. What do they really want?